Townhall. We're just in time for this. This is a conversation around the vaccines. We know now 11 countries have so far suspended the use of the Oxford AstraZeneca vaccine after claims of blood clots. WHO says the clots have no relation to the vaccines, but the latest countries to actually suspend them, that's Germany, Italy and France, say they are doing that as a precautionary measure. Now here's the issue. That same vaccine is here in Kenya with us. More than 1.2 million vaccines have already been gotten by Kenya. They've not been issued. About 10,000 people have been vaccinated so far. Joining me now is Dr. Collins Tabu, is the head of Kenya's National Vaccines and Immunization Program at the Ministry of Health. Thank you so much for making time for us, Dr. Collins. And you can send in your questions. I see a lot of them already coming through. They'll give them priority on video. You can send them through on our WhatsApp number. You can also tweet at Trevor Mbija at Citizen TV Kenya. Use the hashtag Monday Report. Also send in an SMS. Tell me where you're texting from and where and your name as well. That's on 22422. I already see some of them coming through. We'll sample them in just a bit. Dr. Tabu, thanks for making time for us. So we know now that 11 countries have so far suspended the use of the Oxford AstraZeneca vaccine. That's the same vaccine that we have here. Is there a need to be worried?
Thank you, Trevor, for having me here. 11 countries have suspended the use of the AstraZeneca COVID-19 vaccine. I'd like to note that this is a temporary measure and a precautionary measure. As a country, we don't have reason to worry, but rather we remain vigilant just to assure and be sure that whatever we're rolling out to prevent COVID-19 really achieves its objectives.
You have been vaccinated, right?
Yes, I've been vaccinated.
Have you experienced any side effects?
No, nothing untoward, other than the discomfort of the site of injection. It stays a bit of a while to wear off, maybe 3, 4, 5 days. I have not experienced any major side effect, and I can say of the close to 20,000 Kenyans that have been vaccinated, we've had reports of minor side effects that would be expected. Mild fever, some people have had joint body pains, a bit of chills and mild fever here and there, but we have so far not reported any severe adverse reactions, but we continue being watchful, vigilant, just so that we do not miss anything.
At what point will you then, shouldn't we take that precaution? Because other countries like Germany, France and Italy, the latest, have said that they're suspending it out of precaution.
Well, Trevor, let me step back a bit. I'd like to state without any iota of doubt that the AstraZeneca vaccine, as it is from previous trials, has been proven to be safe and effective against COVID-19. And that's where we begin from. Number two, as we begin, the incidences that have happened that have led to the temporary suspension of the use of AstraZeneca within these regions have not happened within our areas of jurisdiction. Now, these incidences relate to blood clotting events, and by preliminary information, the rates of these blood clot events are not significantly, or rather they're not any higher than what would be happening within the general population. But it is just that they're considered severe enough events to warrant investigations. What is going on is a precautionary measure. As investigations are being rolled out in the next few days, they will make a determination. As I speak today, the WHO and the European Medicals Agency have pronounced themselves over the matter, and they've been able to state that the vaccine is safe, that we continue using the vaccine in the context of COVID-19 pandemic that we are in, and that we continue watching out for these events and documenting them and investigating as appropriate.
Okay. Yeah. I want to bring up some video questions that are coming through to our newsrooms just now, but Erastus M. from Mombasa here on 22422 is saying, Trevor, if other countries have stopped the use of the vaccine, including those countries where the preclinical trials and clinical development and approval was done, what about us Africans? Are we not misbehaving by accepting to use that same vaccine? That's from Erastus in Mombasa.
Thank you. The decisions are made based on the country context, based on the context that we are in. First of all, the vaccines are made in such a way that they're not expected to cause harm. or basically to minimize any whatever side effects that would happen. This is not to say that any side effect would not happen. Vaccines, just like any other medicines, have, or rather have some side effects, but by and large they're expected to be minor.
Yeah.
Serious side effects need to be investigated. We have not had such, and we're following up very closely. Those countries have reported linkages, and these reports that have emerged do not necessarily mean there's a causal relationship between what has been reported and the vaccine in itself. Just for example, to give you an example of how seriously these matters are taken, if today I got vaccinated and I went out of this building and sort of fell down or knocked myself, or matter to knock me, I must be investigated as to why that matter to knock me in the first place. And if I might just state, for us as a country, the steps that we take, and just to assure Kenyans that we are leaving nothing to chance. If we have a side effect of that magnitude happening, first of all, we manage a side effect, but of urgency is that we report. And we have a system of reporting within every health facility, and beyond that we have an online portal belonging to the Pharmacy and Poisons Board, through which then we are able to report. When these reports are made, an investigation is launched, and have those teams trained locally, independent teams that are able to investigate and verify the existence of the side effect, and able to subsequently, beyond the investigation, establish whether there's a link to the vaccine or not. When this happens, we just don't look at the vaccine. Often when a side effect happens, we think the vaccine. But what are the possibilities when we have something untoward happening from a vaccination process? It could be product related, that is actually the vaccine itself. Most of the time these are very rare. It could also be a product quality, a vaccine quality defect, which is rare again, but more often than not, it is a programmatic error in terms of how the vaccine was handled and managed, which again the investigations bring out, and that's the most common that we see. And number 4, we could have coincidental events. As having a vaccine being given today, it does not obviate the other health events happening to us. I mean, if you suffered malaria the day after being vaccinated, we have to investigate you, but it doesn't mean that the malaria actually came from being vaccinated with the COVID-19 vaccine. And beyond that, there's other anxiety reactions that come up. I felt the other person said they would feel fever. I think I'm also feeling a bit feverish. So investigate all of that in totality, and I can tell you very few actually result from the product itself, the vaccine itself, because it's gone through a rigorous testing process for it to be assured of safety.
So out of these 20,000 people who you say have been vaccinated, have we lost any patient, whether it's for other reasons or not?
We have not lost any patient.
Out of all the 20,000?
Out of all the close to 20,000, and we have not reported any severe adverse event.
Okay.
As we speak today.
All right. Let me bring up a question from one of our viewers coming through to our studios.
Should really move swift and stop the vaccine from being in circulation, since it has proved disastrous, and it should be at the front line of protecting its citizens. Since other countries have stopped, I think the Kenyan government should also join suit.
Those people who have already have the vaccine, the side effect that they're having, how long is it taking, and can we be safe to say like maybe there will be more of those side effects? My concern to the professional is what measures are we taking as a government, or the government of Kenya is taking, because if we continue with this vaccination and we can see their side effects, how safe are we? How safe is this vaccination?
Okay. Dr. Collins, I think you had answered the first one as to why it's not time to suspend it yet, but there's a question about how long the side effects lasts, which you also mentioned, the pain and the feverish, and then the measures that the government is taking. Yeah,
so just to get back to this again, the vaccines for us is a game changer. So it comes to basically complement the efforts we have in place to prevent, to mitigate against the COVID pandemic. For us as a government, we have a dual mechanism of active monitoring for any potential side effect we do not segregate to say we're picking out only the major side effects, but we go to the depths to pick out anything and everything, and we encourage you to report. So we have a mechanism for reporting of all of these side effects, and we have a mechanism in place, an independent entity made of independent experts in academia, research, and all that, to follow up and investigate these side effects. But beyond that, we have our own regulatory mechanisms that make independent evaluations of all of the vaccines, just like the other medical products that we deploy within the country, and make independent decisions thereof. So just like the other medical products, the COVID vaccines are evaluated and licensed independent of each other, and merits met thereof. So the AstraZeneca vaccine, as it is now, has been evaluated and found to be safe and effective, and therefore has been licensed within this country. This does not mean we have a blanket sort of acceptance of the vaccine, but just like the other medicines, we have what we call the post-market surveillance. We continue monitoring the vaccines in the real world setting to ensure that it is effective. And then beyond this, again, there are actions around this monitoring that we do expect. Say, for example, we identify a vaccine batch that has a problem. Just like the countries in Europe would be able to recall that specific batch. I'll share, for example, Denmark, Romania, and a few of those countries. They did not suspend, give a blanket suspension, but rather they suspended a specific batch of that particular vaccine that had been sort of like distributed within that area. Germany, Italy, France gave a temporary suspension, precautionary sort of, to allow investigations, and the European Medicines Agency will be making a proclamation around this Thursday around the COVID-19 vaccination again. So as a country, I want to assure Kenyans that the government is vigilant, that we have all the regulatory measures in place to assure we only deploy the safest and most effective medical technologies, including vaccines, in place.
Okay.
Thank you.
And it's still on the same issue of the side effects. How long do the side effects last?
Often the side effects are expected to be minor, and most of these, again, I need to be able to share with Kenyans that they are not as a result of the vaccine being bad, but most of them as a result of the immunogenicity, the generation of immunity, the body generating immune responses as a result of administering the vaccine. They are self-limiting. They go off on their own most of the time within about 72 hours or thereabout, a few days. They are not expected to last very long.
All right. We have Irene here from Riara. She says, can the good doctor address the issue of the vaccine and those who are highly susceptible to allergies? Should you be vaccinated if you have any allergies?
Yes, you probably need the vaccine more than the others. For example, asthma is sort of like a severe allergic condition. If you think about it, it's a form of allergy. And asthma is a chronic medical condition that perhaps predisposes you to severe COVID-19 infection. So you probably stand to benefit more from the vaccine compared to someone who does not have these kinds of allergies.
Okay. We have... But wait a minute, there's an issue about people who are allergic to things like fish and maybe eggs. Should they also get vaccinated?
The latest advisory is that those individuals would still benefit from vaccination. Okay. So the latest advisory that we got from WHO and the vaccine manufacturers is that they'll benefit. So it's no longer a contraindication.
Okay. Wero Tumporiong says, when a vaccine is reported as having 62 to 63% efficacy, what happens to the remaining percentage of 38% or 37%? Does it mean some people will be vaccinated and still contract COVID-19? He says he's watching from Kapenguri.
Thank you, Trevor, and thank you, Wero, for that question. Since the beginning of the pandemic, Trevor, we have focused attention on the individual. But remember, the world has moved together and the focus needs to be on the community. We need to be able to appreciate the beauty in the forest rather than the beauty in the tree that makes the forest. And therefore, so when we're looking at a vaccine that is 62 to whatever percent, it is still as effective in terms of stopping the pandemic. I'll just give it an example. The vaccines that we use within the context of the routine immunization program, the rotavirus vaccine that has brought down the rates of deaths in children from rotavirus diarrhea by about 2/3, just has about 50% efficacy. The malaria vaccine that is driving down the rates of severe malaria in children is just about slightly less than 40% efficacy.
Yeah.
So in terms of looking at the vaccine, the efficacy rates looks at much more the individual, but we need to look beyond the individual to look at the population dynamics and see what the impact is in terms of reducing the burden of disease in the community. And therefore, the impact is higher, the effectiveness of the vaccine is higher. Beyond protecting the individual, it needs to assist in stopping the transmission. It needs to assist by protecting even those that are not vaccinated by way of herd immunity.
Yeah.
So the benefits of the vaccine extend beyond the percentage that we see.
Okay. Have you, as the ministry, completely ruled out the suspension of that vaccine, or will that depend on a day-to-day analysis?
So we have not ruled out the suspension of the vaccine. For now, it still remains our very important tool, or like the game changer for stopping the COVID pandemic. So the considerations around suspending or the use of the vaccine or thereabout will depend on the monitoring of the information that comes through. And just to share, by the way, why this is critical that we get as many people vaccinated as possible, even as we continue monitoring, is Israel today has eased out the lockdown measures as it is. Yeah. Why? The successes are largely because of the vaccination program that they've rolled out.
Okay. Yeah. John Okwisia from Nairobi says, what is the minimum age of vaccination?
So we're giving the vaccines to individuals who are 18 years and above. And for each phase of introduction, remember the government did say we have phased out the introduction in 3 phases. So each phase of introduction has specific target groups that we are focusing on. In the first phase, we do seek to assure the continuity of the essential services that maintain the functioning of the economy. In the second phase, that begins from about July of this year to mid next year, we seek to be able to protect the individuals that are at risk, most at risk from severe COVID-19 disease and death. And beyond that, we seek to protect other vulnerable individuals in congregate settings and also achieve equity beyond the most vulnerable populations.
Okay.
So in all of these age groups, we take out individuals who are 18 years and above.
Okay. Yeah. Washala Kenneth says, do you have a mechanism to identify fake vaccines?
Yes, we have a very strong mechanism to identify fake vaccines. First of all, there is an import, the import procedures or licenses issued for each batch of the vaccine that comes through. So no one will just bring in a vaccine disguised as something else. Beyond that, there's a post-market monitoring of these vaccines to assure that they're of best quality thereof. And again, beyond that, there is the batch testing for the vaccines, even when they're out there, that happens on a random basis and coordinated by the Pharmacy and Poisons Board.
Okay. Yeah. Let's bring up another question on video before I go into the SMS questions and the Twitter questions as well.
Over the time, people just assume that corona isn't there and you find yourself in another wave. So Kenyans should just be careful, and we cannot fight corona by ignoring it. We should be serious about it and just deal with corona by social distancing and just following all the rules.
I once again ask, why isn't there vibrant public sensitization about this COVID-19 vaccine? What is there to hide? Who will demystify the myths floating all over?
Nektari?
Thank you. That is much more of a notion than the reality. Remember, the COVID vaccination rollout is targeted, it's phased out. So is the messaging. The messaging comes in several forms. One, we have the capacity building of the specific groups by phase to empower them with the information. Beyond that, when we move now from the targeted vaccination that we're having now, we move to the public arena where we're not going to have a lot of mass media messaging going out there. And now you'll see a lot of engagement on TV, on mass media, local vernacular stations, and so forth.
Yeah.
And then beyond that, we will move to the community level, where we'll expect to have a lot of community engagement, and these plans are already underway and starting. A lot of community engagement, allowing the community to take ownership and really decision making in terms of the COVID vaccine rollout. So the way it has been done is that we have had an opportunity to allow each of the 47 counties to have a go at the introduction. We have targeted introduction by the first phase, based on the groups that we have shared. So the messaging is largely there, but in the next few days you'll see broad-based messaging within the public domain. Again, as we move on beyond this targeted group to the other groups that are targeted for those phases. So just like the other vaccines, again, I'd just like to draw parallels here, that the information flow goes in phases, and of course there is the desire to match the demand created by the information flow with the supply side of the vaccine. We do understand that we have the very, very limited stocks of the vaccine. So we need to be able to match that with the demand side of it all, even as we move along by way of sharing credible messages around this vaccine. So this is coming through.
Okay. So you're saying the Ministry of Health is absolutely confident that this vaccine is safe for Kenya?
We're absolutely confident it is safe for Kenya. We continue monitoring for any safety signals that come up along the way. This is not to say having certified it is safe, we would not be able to pick up something along the way that then would allow us to make some decisions as we move along.
But the fact that WHO says it is safe should be a source of almost relief, right? How come this is not happening? Is this normal with other vaccines where theories start coming up and rumors?
Thank you. The WHO says it's safe. The European Medical Agency says it's safe. In Kenya, we say it is safe. It is not the first vaccine to encounter this kind of challenges. I'll be able to share with you that a few years ago, we did roll out the HPV vaccine against cervical cancer. And just as we are talking efficacy, this is a vaccine that is about 99.9 efficacious in terms of preventing cervical cancer. We encountered this, but over time, we've been able to debunk the myths, and people have been able to use it and been able to see that, look, it actually works, and it's actually have not resulted in side effects. We've had the same sort of like myths come up with mass vaccination campaigns for measles, for instance. We've had the same myths come up with polio vaccination campaigns, and even the tetanus vaccination campaigns, therefore. We have had people vaccinated, and like you'll bear my witness, we've not had any major side effects thereof. So we continue engaging, we continue sharing facts, we continue dispelling myths, we continue partnering with communities to be sure that we are disease-free. And noting that I would not be safe, I wouldn't be safe until everyone else within our communities is protected.
So now that you got vaccinated, how long did your side effects last when you said there was a bit of a pain in the site, which is normal for any injection, really?
First of all, just to share, I did not have to interrupt my schedule. I continued working immediately after and the day after vaccination. I have not had to interrupt it.
You were like the fourth person in the country to get vaccinated?
I was like the fourth person in the country to get vaccinated, beyond our Director General and the CEO Kenyatta, amongst others. By the third day, really, I could not feel anything. I wouldn't make a difference. And the discomfort is not anything more than the regular antibiotic injections would get from the clinics. Perhaps even the antibiotic injections are more, more painful, probably more side effects.
Kipleting Manuela says, can vaccines be given to those who have already recovered from COVID-19?
Yes, certainly. Even if you have suffered COVID-19, you stand to benefit from COVID-19 vaccination, and we encourage you to take this vaccine, perhaps at least 2 weeks after you fully recovered from COVID-19 infection.
Let's bring up another question on Twitter before I get into the 22422. Remember, you can send in all your questions on all platforms.
What are the next steps that Kenya is planning to take, given that most of the countries are declining the use of AstraZeneca vaccine? Thank you.
What is the plan?
So for us as a country, we encourage our people to take up the vaccine. It remains our hope to death to stop the transmission of COVID and get back to normal functioning. The other countries have not declined the use of COVID-19 vaccines, AstraZeneca vaccines. The other countries have taken a precautionary measure based on the batches that were sent to them. They're investigating, and within the next few days, we'll have WHO, the European medical agencies in those countries make a proclamation around this.
Yeah.
And remember, these are countries that have many other options to them compared to us as Kenyans we are today. So we need to embrace the best tools that we have in fighting COVID and be able to move forward in protecting ourselves.
Okay. That is almost related to what Robert Ogugu is asking here. He says the doctor should convince me why I should be given a jab that has reported some side effects when I am not even sick. I'd rather continue isolating and washing my hands.
Just to share on that again, the side effect that has been reported, Trevor, I'll repeat, is about blood clotting. And about 15 cases of deep venous thrombosis, just blood clots forming in the deep veins, have been reported out of 17 million doses that have been given out there. And the data that is being shared is showing that the rates of blood clots happening in the general population is perhaps higher than in the population that is having been vaccinated. So the investigations are going on. But beyond that, just to share that even within our country, these incidences of blood clots are dependent on other factors. They're dependent on our lifestyle choices. Are we smoking? Are we drinking too much? Are we having a sedentary lifestyle so that we don't have a lot of blood circulation? Are we having pelvic surgery? Do we have a malignancy or cancer or something like that that then impacts the circulation within our system? So for us within the country, we see, and globally, we see a lot more blood clots events or something like that happening within the context of these other conditions compared to what is now being reported around the vaccine. And just to share what we're seeing as reported, the other 22 cases of embolism, pulmonary embolism, is when now one of those blood clots perhaps dislodges and goes up and blocks the blood circulation to an organ. So it could happen to the lungs, it could happen to the heart, it could happen to the kidney or any other area. So like I said, the incidences that are being reported have to be investigated and be positively linked to the vaccine. Why are we insistent as a country again? Among the side effects that have been reported to be linked to this vaccine from the studies that have been conducted world over, none of them identifies blood clots as being one of the side effects, as one of the side effects that are linked to it. And remember, Trevor, this vaccine was again tested within this country, within our own borders, and we found it to be context specific for us. Within those trials, no such events have been reported. Okay. So for us, we do not ignore. We urge vigilance. We urge you to take the vaccine to protect our communities and ourselves from the COVID pandemic, even as we follow the other regulatory procedures that then will unravel issues.
Okay. I have to take a quick break here, but Grace Toretich is wondering, is the vaccine suitable for pregnant women?
The vaccine has not been tried in pregnant women. We'll only recommend the vaccination of pregnant women if the perceived benefits of that particular vaccine far outweigh the risks to the unborn baby. The risks to the unborn baby is not anything documented, but largely the lack of information because the vaccine has not been tried in that particular population before. For instance, if you have a pregnant woman who has chronic disease, renal disease, lung disease, cancer, and so forth, and you realize that they probably stand to benefit much more from this vaccine, then you perhaps want to consider giving this vaccine, documenting it, and providing active follow-up. But having said that again, for our borders again, we do not encourage the screening for pregnancy as a precondition to giving this vaccine. Thank you.
All right, there's another question from Daniel who says, I just want to know a bit more. Those who are infected with COVID-19 and hospitalized, can they get the vaccine as a priority? Can you be administered the vaccine when you have COVID-19 already, or do you have to wait until you're healed, or without it?
So if you have confirmed COVID-19 infection and you are ill, then you want to wait until you have healed from that particular infection, at least 2 weeks after, for you to then be able to receive the vaccine. If you have illness severe enough to cause you to be hospitalized, you want to be able to manage the active infection first and recover before then you can receive vaccine. But however, if you have an illness that is minor, that has not necessitated hospitalization, then you can receive the vaccine.
Okay. And someone else is asking, I think it's Vienna from Kitengela, says, ask him if once he has been vaccinated, if you should stop wearing your mask.
Thank you. So even when you have been vaccinated, fellow Kenyans, you still need to be able to observe the health protocols. You need to physical distance, you need to sanitize, you need to still wear your masks. Remember, the vaccine does not prevent COVID infection. The vaccine does not prevent the virus from coming in, but it is able to allow your body have a good enough immune response to protect you from severe COVID-19 disease and perhaps death. You realize our ICUs are full and we're having many deaths from COVID-19. These many deaths and these severe diseases that are causing our ICUs to be full could be averted by COVID-19 vaccination.
Okay.
So we'll be able to get infection, but it will not be severe. We may, in a few instances, be able to transmit the virus once it's in our bodies, and that's why we still need to keep the masks on, even when we're vaccinated.
Masi Kim Chong says, is the government prepared in case we have side effects from the vaccine?
Yes, the government is prepared in case we have side effects from the vaccine. Every vaccination center has protocols in place to be able to manage any adverse event that happens there. And that's what we're talking about. First of all, managing any adverse event that would happen at that particular level, administering the appropriate medical treatment. Before then we can move on to the investigation part of it and the reporting and investigation part of it. Every facility that is going to roll out the COVID-19 vaccine, you realize, ladies and gentlemen, that a few things have been done. Number one, we're going a stepwise in terms of introducing or rolling out the vaccine, not just a blanket rollout like has happened with other vaccines. This is to ensure a state of readiness of all the health facilities that are participating. Number two, we are documenting through an ICT platform all the details of people that would be vaccinated, pre-registering, scheduling the vaccination, and being able to have an opportunity to follow up these individuals in case anything happens thereof, whether now or in future.
Okay. Amos Kipchirchir says, why can't leaders like the president, health CS, governors, and other leaders take the lead and get the vaccine first so that it encourages the rest of us to get that vaccination? Tabu Charles of Bunge la Wazalendo is also asking the same thing. He says, why is it that our MPs are not taking the vaccine? Are we safe if the importers are not ready to get vaccinated?
Political question, but I'll let you know that perhaps we have the best leadership we would ever get. Perhaps we have the best patriotic leadership that would ever get, in that they have prioritized the people who need the vaccine most. Remember, we have just gotten 1.02 million doses of this vaccine, and we have so many people at the front line really working to protect the country from the effects of COVID-19. So our leadership has said, look, they will take the vaccine when their turn comes. And you have seen on the media, a number of governors have taken the vaccine already. So there is no strict guidelines about our leaders not being able to take the vaccine. His Excellency pronounced himself on this matter and said he will take the vaccine when his turn comes. And yes, we did prioritize our leadership within the coming phase of vaccination.
Okay. And Mutungi Kamundi says, can one choose another vaccination other than the AstraZeneca one? Do we have a better option as a country?
As it is for now, we have the AstraZeneca Oxford vaccine. In the next a few weeks or months, we will have other options coming in, either through the government or the private sector. But for now, what is at hand for us is the AstraZeneca Oxford vaccine. And because of the need to be able to stem the pandemic within our borders and resume normal functioning, then we're prioritizing that everyone gets vaccinated according to their phase of
all right. I believe we have to take a quick break here on Town Hall. When we come back, there's still a lot of your questions. I'll try to squeeze them in as much as I can at Trevor Mbija at Citizen TV Kenya, #Monday Report. And we also have 22422. That's our SMS line. Just let me know your name and where you're texting from. And I believe you can still squeeze in one or two more videos. We'll be back in just a bit.